Okay, hi, this is Dr. Nikitow. So what I want to show you is I want to show you a little bit about when we're marking up an x-ray, how important it is to have the proper exercises to give the patient for spinal correction. Remember, we're changing nerve muscle memory, so we're not pushing bones into place. So you have to work on the slower nerve receptors and the faster nerve receptors, the faster ones being the ones that we adjust because we're using a high velocity movement in the mirror image. But you also want to give the patient exercises in an isometric holding pattern that will fire the slower type of nerve receptors in the joints. If you're not sure about some of this stuff, you want to pick up and look at our videos and tapes on articular neurology, and we also talk a lot about this in the Adjusting with Certainty, the ABC, or All Body Chiropractic Adjustment with Certainty videos and courses that we have that you can get from Certainty. But what I want to point out over here, if you were to take a look at this x-ray, you will see that this patient, this would be the left side, this would be the right side. And so what we're looking at here is once we draw this weight-bearing line on, I've got this in a computerized program called OpalRad. But basically what will happen is this will line us up, and all these little dots are in the center parts of the vertebrae. We'll see that she deviates quite a bit off to the side here on the pelvis, and then on the neck area over here, she's deviating to the right as well with a drop skull on this side. Okay, so I'm going to blow this up a little bit. So up here, you'll actually be able to see how her neck is really curving off to the side here. So we're going to be giving her exercises that go in this direction because she has a right head translation. When we go down to the pelvis, let me shift this up here, you'll see that the pelvis is really shifted off to the right side as well. She's got a curve or a scoliosis here, so we'll be using some wedging here to open up this wedge that she'll do at home. It's a foam wedge, but she'll be doing exercise where she's actually shifting her pelvis to this side. And we'll also notice that her ilium is a lot smaller here and a lot wider, which indicates that her pelvis is rotated backwards, so we call that a negative Y. So the pamphlets we'll use when we are bringing, when I'm marking up the pamphlets for this specific distortion pattern, we'll actually use our pelvic ChiroMetrix exercises. I open it up, and this is how easy this is. I designed this because I have a high volume of patients, and I don't have time to be sitting around explaining exercises to them, giving them ugly Xerox copies that are all smudged. So I created these brochures for our profession, and these are all the different types of major distortions we see. This portion of the pamphlet explains how the correction works and always applies to chiropractic in terms of what we actually do in terms of our core philosophy of subluxation. And then what we would do with this type of distortion is we would, since the pelvis is shifted to the right, she has a right hip translation. All I do is go put an X there. Left thoracic, I go ahead and put an X there. She has a left forward pelvis, which is a rotated pelvis. Okay, so the left is going forward. Make the notation here. And then I tell them, I said that how many you do and how you do them is on the back, and these are the specifics of what you would do in that brochure. For the cervical spine, what we would do is we would show her this pamphlet and just mark this off. This is just as simple. So what we do here is she has a right-headed translation with a low right ear. So she's going to drop her head down and then push her head over to the side. Now, when we look at her side view, we see that she doesn't have much of a curve, and she has a bit of a forward head, but not a lot. If we were going to look at a forward head, we would just drop a line here, and that would give us our measurement. She seems to fall pretty close with her forward head. She's got maybe 7.8 millimeters of forward head. This is what the normal curve should look like. So basically what we want to do is get this curve established. So in addition to the translation, what we're going to do is have her do these exercises here. We were also going to have her do the skull flexion exercise here. Now, normally I would give her this exercise for forward head, but she has a little too much sway in her back, so we're not going to give her that exercise. Instead, what we're going to do is give her some other exercises for her lower part of her back, because when we looked at the low back here, we actually see that her weight-bearing line, her Ferguson weight-bearing line, is falling too far posterior, so her pelvis is too far forward. So what we want to do is strengthen the stomach muscles, and these are the Stewart-McGill protocol that we use in our core exercises as well. And we will give her a lot of these exercises here that will help her restore that pelvis to come backward. Again, we don't want to overload it this way. We want to kind of just do some of these specific exercises. And then again, The low back exercise explains the core philosophy of chiropractic, how this whole thing works. And on the back, it talks about strengthening, stretching, and isometric types of exercise. So these are extremely valuable when we're using these and marking up our cases, because it takes just nearly a few minutes. And so I would really encourage you that if you're going to be doing any kind of spinal correction exercises, that you're using these things from our ChiroMetrix series that you can get from Certainty. Hi. What I want to show you is our little exercise rack. And basically what we have here is our ChiroMetrix exercise, which are the isometric exercises for spinal correction, okay? Which, again, I was just showing you when we mark up x-rays how we mark the distortion. So if we see a patient, for instance, that has a certain distortion, we will just pull the pamphlet, check the thing off, and then share with them the back here, which tells them how to do the exercises and which ones to do. Now, let's say a patient comes into me and they say, well, I hurt my shoulder, can you check my shoulder? I hurt my hip, or I hurt my ankle, whatever. Okay, so what I put together here, because I knew our profession did not have good exercises, okay? We have these Xerox copies, smudgy, ugly looking things. What you have to have if you want to represent not only the chiropractic profession, but you and your clinic versus the guy down the street using the Xerox copy stuff, and you don't have time to do exercises, you want to have a good quality pamphlet. So what we did is we put together what we call the ChiroCise, which is exercises. What's the chiropractic approach? So when you look at something like we see here, like for instance shoulder, and we see the chiropractic approach to shoulder exercises. Now these are some of the most updated physical therapy type exercises and quality types of things that you'll see. We also made these so people can do certain things at home. So let's say a patient says to me, well, my shoulder hurts. So I do a couple tests and all of a sudden I do some adjustments. I will open up the pamphlet and then I will check off whatever exercise they will need. So if you look at this specific pamphlet over here, it's got all sorts of different exercises. Let me show you a couple of important things about this. Number one, we have stretches and then we have strengthening exercise. Now you'll notice the guy is using a purse. Okay, and what we recommend is you could use weights, you could use a household item, because sometimes you'll have elderly people that don't belong to a gym. Well, what do? Well, we have to show them different resources that they can use to do the exercises. So here's a purse, you can put a can of soup in it or a rock or something like that, and you could go through different types of exercises. Here's some physical therapy exercises which are absolutely phenomenal for range of motion when you're using the stick and using the towel and different things like that. Now, for every type of ChiroCise type of exercise we do, we always look at, when we say the chiropractic approach to, we always bring in the spine. This is really important because people don't often think that their neck and the subluxations they have here have anything to do with this. This is the most important thing. You've got to adjust this area right here because these are the nerves that are going down the arm to the hand and fingers. So we always want to bring them back to the core chiropractic principle of subluxation, which is what every one of these pamphlets do, from ankle, foot to knee to any of these other ones. And then on the back, again, we always explain how you would do a stretch, how many you would do, same thing with isometrics or strengthening exercise and things like that. So if you don't have things like this in your clinic, this is a really, really easy thing to be able to use, especially if you're using high volume. Because when you're using high volume, if you're in a high volume type of practice like we have, I don't have time to sit there and explain exercise to people, but people are always looking for exercise and looking for quality types of stuff. So what you do, you make your adjustment, and then you come over to the pamphlet rack, you open it up, you check off the ones that they should do, you just hand it to them, and you're on to the next patient. It works absolutely phenomenal.